All righty. So you can continue as people are coming in. Feel free to let us know where you're from, your name, major, and we will get started here. So everybody, welcome to the fall 2023 new student orientation for the Global Health Program. Please note that this will be recorded, and by remaining on this webinar call, you consent to these conditions. And we wanted to start off by introducing our advising team, which is myself and Brittany. So my name is Erin Warren. I am the undergraduate advisor for the Global Health Program. My pronouns are she, her, hers. This is going on my 5th year in advising here for this program, and I'm just so excited to have you all joining us at UCSD in the fall. Global health is, and I'm biased, it is my favorite major on campus, and I think I've seen it do amazing things, and students go through an amazing educational journey here, and so I'm very excited that you'll be joining us. And I will turn it over to Brittany really quick.
Hi, my name is Brittany Wright, and I'm primarily the grad advisor for the MA in Global Health, and I've worked with the Global Health program since it became a major in 2014. So we're going on our 9th year as a program, and we're going on our 4th year as for the master's program. So we've had a lot of growth in those 9 years. And when Erin is out, sometimes I'll be assisting, or if you have any questions about the master's program, feel free to reach out. And thanks for being here.
Awesome. We definitely wanted to introduce our Global Health Program student representatives. They are the knowledgeable, essentially peer advisors for our program. They help put on events, and you'll be seeing a lot of them throughout the next year. So we'll start with Mira.
Hey everyone, my name is Mira. I use she, they pronouns. I'm going into my 4th year at UCSD. I'm pursuing the Global Health BA degree, and I'm also minoring in health and social issues. Erin, was that it? Did I miss anything?
Yeah, that's perfect.
Okay. Cool.
Okay, I can go next. Hi, I'm Suhana. I'm going into my 2nd year. I use she, her pronouns. I'm pursuing the BS in global health, and yeah, I think that was it.
Hi, my name is Zoma. I am going into my 4th year. I'm majoring in human developmental sciences, and my minor is in global health.
Awesome, thank you all. And again, you'll be getting to know these folks throughout the next year, and we have some fun things that we're starting to plan for you all as we slowly approach fall quarter. But I wanted to start before we kick off the orientation. I wanted to share 2 frequently asked questions that I've been getting that I know a lot of you probably in this chat are thinking about, which more recent questions that I've been getting. The first being, my enrollment time was originally this week, but now it's at the end of August. What happened? Enrollment times did change, so you do have that correct. They did change because there was a delay in new student transcript posting. So you'll want to note the dates based on your status as an incoming student. If you're a transfer student, first pass will begin on the 28th. First year students will begin on the 29th. And as a reminder, we use the 2-pass enrollment system here at UC San Diego. So your maximum amount of units you can enroll into up for your first pass is up to 11.5 units. Second pass is 19.5 units. So by second pass, you should have an idea of what classes you're going to be going into the quarter with. Of course, wait lists happen, which we will talk about, but wanted to bring that up. The second question that I wanted to answer is, will I be able to get into courses? It looks like seats are full in the GLBH courses. GLBH is courses that we schedule from our program. And yes, we are adding more seats to Global Health 20, Global Health 100. 114, 116, 148, and 181, starting Monday, the 21st. This is when continuing students can no longer enroll. They're blocked from enrollment because we want to give you all time to be able to enroll. And please check with other departments if you have any interest in other courses, because they ultimately have control over the enrollments. We just have GLBH oversight. So just wanted to address that. And then quickly wanted to get into the goals of orientation here today. We'll go through what is global health, major requirements, the field experience requirement, some tips that I have for you on enrollment, a Q&A, and then just brief info about our second part to this orientation in fall 2023. This will be in person because we would love to get to meet you all when you're on campus. So we'll have some info there. But wanted to start off by just going through what is global health. It is a broad term, and so we have it in a very brief couple sentences here, but essentially global health provides you with an understanding of how to productively intervene in processes of health, illness, and healing across the globe. This is on our website, so you can continue reading about a little more about into what you're going to be delving into, but I also wanted to highlight how interdisciplinary this program is and just the topics that you'll be going through, everything from healthcare, infectious diseases, reproductive health, health inequities, impact of natural disaster and political violence. You'll notice that we take courses from all over campus, different departments, and that's because, you know, it being such a broad topic, we want to have specific specializations within that and, you know, have you explore different facets of global health. So again, on our website, there's a lot more info as to, you know, exactly what you'll be studying, and we'll be getting into some of the major requirements, of course. But I also wanted to dive into a little bit more about academic advising, because I know this is a common question that students have as you're navigating this big campus. Academic advising at UCSD is shared by two different sets of advisors. We have college advisors who are primarily overseeing your general education requirements. You know, you might be in Eleanor Roosevelt, you might be in Marshall, you might be in 7th. They all have different requirements, so they oversee that, as well as petitions for their colleges, university policies such as academic probation, disqualification, withdrawing. They also oversee, in general, transferring units or courses from other institutions. We can advise based on the global health end of it, but in general, if you have questions about the amount of units you're transferring, you'll want to start with them. And then in contrast, we, as the major advisors, advise on all things global health, major requirements, petitioning courses for credit towards the major, field experience, which we'll be talking about, and special studies courses, which could be independent research, it could be an internship. These will all be covered in part 2 of the orientation, but we assist with that. And in terms of global health specific advising, there are a variety of different access points and also events that will happen throughout the year. The first point of contact that we hope you utilize is sending a message in the back, which is going to be available once you enroll in courses. Now you have access to the EVAC right now, but you'll get access to the full VAC suite once you formally enroll. We also will have drop-in advising. This will happen 1 to 2 times a week via Zoom. And we'll resume during fall quarter. You know, this method is for quick questions that don't require a full-on appointment. We may do a drop-in advising around the time that enrollment starts to answer quick questions via Zoom. We'll send more info about that. But the other method that we have is requesting a formal 30-minute appointment by contacting our email address. And we have on our website current hours and what's needed to schedule an appointment. And this is available after course enrollment. Reason being is we want you to experience utilizing all the info on our website. We want you to be able to, you know, take ownership of your schedule, and we'll be there to help fine tune it after the fact. But hopefully through this orientation, you'll have a clear idea of the types of courses that you can enroll into. That's a little bit more about our advising. So I wanted to dive into the major requirements, the bread and butter of what you're going to be doing here in global health. So we'll start with the BA major. If anybody in the chat, if you want to put that you're in the BA, we'd love to know who's in the BA, who's in the BS. We'll start with the lower division series of courses. There are 3 courses that you take, 1 intro course, 1 sociology course, and 1 statistics course. So the course descriptions for all of these can be found online and exactly what you can take. And lower division, what we mean by that is anything numbered 0 through 99. For example, a lot of you will be enrolling into Global Health 20. That is a lower division intro course. So anything numbered 100 through 199 is considered upper division. Now, the BA also has a series of upper division courses. And so this, all students take the first 4 courses that you see here, whether you're in the BA or the BS. It's Global Health 148, Global Health 181, MGT 173, and a policy analysis course. So these are all classes that you'll be taking. We recommend getting these done before senior year so that you know, can, because they're specific courses, they often will fill up. So we hope that you'll take them early on so that once you reach upper division standing, so that all you have is electives and a little more flexibility in your senior year. And then, of course, there's a series of electives that you can see there that the BA takes. The BA does have more upper division courses, elective courses than the BS degree, but the BS does have a lot more lower divs, which we'll go through in a minute. But at least one of the biological science courses must be upper division. So technically you can take 2 lower division. And the last note I have is that the additional upper division elective can be any upper division biological science, medical social science, or medical humanities. We basically give you one more opportunity to take another elective that you know, in one of these elective categories. As well as a mandatory global health field experience, which we will go through in a moment. And then this is just another quick overview. Definitely want to highlight all courses must be taken for a letter grade of C- or better. We do not accept pass, no pass courses. So please take everything for a letter grade. And then again, we'll talk about field experience here shortly. Now on to the BS. So the BS, like I mentioned, does have a lot more lower division courses, and that's because a lot of students who are trending pre-med or pre-health will usually go this route, because you'll notice a lot of these are prerequisites for medical school, nursing programs, PA programs. You know, you can do the BS without going pre-med or pre-health. I definitely want to emphasize that. We have so many students that do that. We just tried to be strategic about it and encompass what was needed for pre-med, pre-health programs in our major to make it less courses that you have to take in addition. So again, 2 intro courses. There is a list on our website of what intro courses you can take there. 1 year of biology. Some of you maybe have transferred in some AP credit or transfer units from a community college. Same thing with chemistry, 1 year. So 3 lectures and a lab. Chem 7L is the lab. And 1 year of math. So this is actually 2 quarters of calculus, which is Math 10A, Math 10B, or Math 20A, Math 20B. They're both 2 versions of calculus here at UCSD, as well as 1 statistics course. So we'll move on here. Oops. Sorry about that. There we go. We'll move on to the electives. So for the electives, again, same upper division core classes as the BA. As far as the elective units for the BS, there are 8 courses, all need to be upper division. There are 3 biological sciences, 4 medical social science, and 1 medical humanities, in addition to the mandatory global health field experience, which again, we'll talk about. But that is the BS major requirements. And again, we have a whole tab of exactly what classes you could take on our website. Briefly touching on transfer coursework. So all community college and AP coursework comes over as lower division. So even if your community college mentioned that, you know, by their standards, it was considered upper division, it's actually the case that everything that gets transferred over is for lower division. So you'll be able to see in your academic history, once your transcript is uploaded, not all transcripts are currently uploaded, what you received credit for. So you'll notice, like in this example, there's Miracosta College, the student took human physiology. The approximation would be our version of Build 26. So you can kind of go and look through our electives to see if we accept that. And you know, you'll see it also on your degree audit if it transferred over appropriately. Touching really quickly on AP courses, we have this list on our website as well, so you can see what score translates to what requirement. If for whatever reason, and I would wait until your scores and transcripts are formally in your audit and when you enroll, but it should eventually reflect on your degree audit if you received a particular score. If not, by the time you enroll, you can send us a message in the back once you get access, and we can update this in your degree audit for you. I really briefly wanted to also touch on the honors seminar. So this is an optional program, an honors program that we have here in the Global Health program, which is a 2-quarter long cohort where you'll actually develop a thesis related to a topic of interest in the field of global health. So this is actually a program that you apply to. And at the end of it, you will have a research poster, you'll have a thesis, and you'll have made a lot of connections with other global health students. And also be able to present at our Horizons Global Health Research Symposium at the end of the year. It's kind of our culminating event. And so I bring this up if you're thinking about long-term planning and if this is something you're interested in. This happens during your senior year, your final year here at UCSD. You enroll into GLBH 150A in winter of your senior year, and then GLBH 150B in spring. And we have this eligibility on our website. We encourage all interested students to apply, but we, based on the cohort each year and the applicant yield that we get, you know, we kind of use these as factors in considering students for the honors program. So I definitely encourage, if you're interested, to you know, explore our website, look at our blog, which this is a little bit more about it here as well, which is on our website, but for the sake of time, yeah, again, too, small class size, you really get to build community and really hone in your writing, critical thinking skills. Students come out of it, you know, having also made really awesome connections with the instructor of the course. And I definitely encourage, as I was mentioning, looking through our poster themes that we've had on our global health blog. You can see all of our previous posters. We even have, from when we were doing this symposium remotely, we have YouTube elevator pitches where you can see students present their research findings. So we definitely recommend that you go and check that out. Briefly, we'll talk double majoring and minoring, because definite you may want to make time here at UC San Diego. Benefit of global is that because we're so interdisciplinary, there's usually a lot of overlap between the you know, our major requirements and that of another major. So for a double major, you need to have a 2.5 GPA. You typically apply when you reach junior standing, which is more than 90 units. And it's recommended to complete a lot of lower divisions, both as possible. We recommend, exploring this with each major advisor to see if it's feasible by the time that you want to graduate. Oftentimes it is. It's very common to see students double majoring if it works. And then in the appointment, we go through the petition process and what is needed. It's pretty simple. It's usually, most of it's completed online now. It's a petition, a long-term plan, and a statement of why a double major is going to benefit you personally and professionally. And I also wanted to share some overlapping courses, or compatible double majors that usually have overlapping courses. We really see biology a lot because you can overlap most of the lower division courses and 2 upper division courses. Global health students can typically overlap with both majors, 2 upper division courses in general. And this is the case for psychology, anthropology, sociology, history, public health. I've seen theater, I've seen communications. Really, you can make it work with the appropriate planning. And we'll have some more info on double majoring in part 2 of our orientation. As far as adding a minor and minoring in general, minors are 7 courses, usually 5 upper division and 2 lower division classes. And you're able to overlap all relevant lower division courses and up to 2 upper division courses. So usually if you're a global health major and you're looking to minor elsewhere, it may be the case that you only need about 4 or 5 classes to obtain a minor. Of course, that's going to vary based on what minor that you decide to choose, but it's very feasible. And we see it again all the time. And, as you heard from our reps, a lot of them have a minor. So another example of it being pretty common. And you can declare a minor on Triton Link. Now for the field experience requirement, which I've been mentioning throughout the call. The field experience requirement is oftentimes students' favorite aspect of the global health major. And the reason for that is because it's hands-on experience, 100 hours of an experience where you're volunteering, doing research, could be study abroad, clinical shadowing, an internship in the field of global health. And it doesn't necessarily have to be credit bearing. So it could be something totally outside of your studies, although we do have some credit bearing programs. It needs to be pre-approved. So there's a whole pre-approval process, or you choose an activity that we've already pre-approved. You can use up to 3 different experiences to make up the 100 hours. And can be domestic or international. Most students will do it either with a global health related organization on campus in the San Diego area, but we do have students go abroad. We have a lot of students on a study abroad program in Bali right now. We have students that will, if they're an international student, they'll go home for the summer and find an opportunity there, and that's fine too. It just needs to be pre-approved by our office. And we have the steps listed on our website. It's a pretty in-depth guide. Really want to hone in on making sure it's something that's pre-approved. And because you don't want to go through a whole opportunity and realize it wasn't something that we certified as field experience. So you can find all of the steps for the sake of time on our website. The last thing I'll say is the way that we verify it is you'll either keep a log or have your supervisor submit a letter on your behalf verifying the details that we list. They ask them to on our website. So that's how we're able to update it on your degree audit and mark it as completed. But we have the whole in-depth steps to, finding field experience on there. We also want to emphasize safety. We have a whole bit on safety on our website, and we ask students, especially students going abroad, to go through our training that we have on our website as well. We really don't want students providing direct patient care, involved with surgeries, or treating patients in a way that, you may not have the qualifications for just yet. We also don't approve animal testing. So if you're doing any research or anything like that, we ask that it isn't involving animals. And again, we have a lot of this info on our website, but definitely want to touch on the limitations of what you can do in field experience. We want it to be something that matches where you're at right now, but still encourages growth and learning in a way that is safe. So definitely encourage you to explore that on our website as well as you're looking for opportunities. I also, again, want to touch on how do you find a field experience. I send out weekly news blasts and monthly newsletters that are filled with opportunities. I also would love for you all to go on and add us on Facebook as well as Instagram, because we're constantly sharing things on there. It's a little more limited in the summer because it's a bit quieter, but during the year, we're constantly posting updates, and a lot of students find their field experience because of the newsletters, because of the Facebook, and because of Instagram. And please read your emails. I know you're going to be getting a lot of them, but that's why we do these news blasts and newsletters, is to condense it all into one. So that's my biggest takeaway, is we are feeding you examples of what is happening on campus. And again, use our website. Our website has a lot. I'd also recommend talking to your professors, exploring internship portals, talking to the global health reps and other students that you're going to be meeting, and also looking at our blog posts. We have a lot of student field experience blog posts that share their experience of what it was like in a particular opportunity that is pre-approved. And I really quickly wanted to go through some more of our specific opportunities that we see students doing a lot on campus. This one right here, Health Frontiers in Tijuana, is a quarterly internship that gets you experience shadowing a student-run free clinic in Tijuana, Mexico. And it is actually a class on campus. It's Global Health 111. And the beauty of this class is the first time that you take it, it counts for 50 hours of field experience and a medical social science elective. The second time you do it, it just counts as 50 hours, but this is often how we see students filling their field experience. It is an incredible opportunity to utilize your connections and network as a border city. The instructors of this course have been doing it for a long time. Unfortunately, they don't accept new incoming students for the fall class, but any class after that, you'll just want to go on their website, and we'll share that out to see what the prerequisites are, to make sure you meet those before you're applying, but they offer it every quarter and in the summer. There's also the Bloom Cross-Border Initiative. This is another summer field internship. It's an 8-week internship where you conduct field work in multidisciplinary teams and addressing issues of poverty in San Diego, Tijuana area. This application gets sent out in spring quarter, so that would be thinking ahead. But there's a pretty nice stipend involved, and a lot of our students have done this. There's also the Life Course Scholars Program, where students, this is through Urban Studies and Planning, students will get experience working with elders of diverse backgrounds and explore the factors of aging. There are a few global health classes that center around aging. So this is a great opportunity if you're interested in this field to get understanding about, the well-being of elders, and you'll actually get to lead a capstone, which is called the Healthy Aging Project. So definitely, if you have questions about this one, USP will send out information about applying. A lot of students, again, do this and develop a community from it. And just a couple other opportunities that we see students doing a lot. There is CFHI, which is a study abroad program that is not credit bearing, but it's where you're able to go to one of their various locations and, pick a subject area and basically volunteer and connect with local health professionals and shadow them. We have some info about that on our website as well under our field experience pre-approved opportunities tab. Flying SAMs, we have a lot of global health students that are on the board of Flying SAMs. That's the UCSD Flying Samaritans that assist at a clinic near Ensenada in Mexico. So, a lot of students will get involved with the organization there and do clinic trips for hours. There's also alternative breaks, which is run through the Center for Student Involvement at UCSD, where you go during spring break, winter break, and their service and learning trips that are global health related. So definitely check those out. Just some examples of what our students we see a lot of students doing. But if you're looking at our website and nothing is really standing out to you, or if you find something in your hometown that you want to see if it qualifies for field experience, then we definitely recommend sending a pre-approval request, which is under the field experience tab of our website, to see if it will count towards field experience. The note I have for you all about field experience as an incoming student is it has to be something from fall 2023 and onward. Unfortunately, if you're involved in something right now, because you're not at UCSD yet, we want it to be the field experience to be within the context of what you're learning about in the global health program. So we unfortunately don't accept anything from prior to the time that you enrolled at UC San Diego. So just wanted to make that note, that it has to be something from fall 2023 onward. Now, if you started something in summer and you're going to be continuing it through the fall quarter, that's fine. It's just the hours towards the 100 hours need to be specifically from the fall 2023 kind of marker onwards. So yeah, that is a little bit more about field experience, and it's going to be something that we constantly share information about during your time here at UC San Diego. And again, it's a really cool opportunity to get to know other folks in global health, get experience, and it looks amazing, you know, as a resume builder for internships, just your professional development outside of your academics even. And so I wanted to use the remainder of the time here to allow plenty of time for questions on how to be successful during your enrollment period. You know, it's coming up. And again, we really want you to take ownership and be, you know, have all the tools and know what you need to enroll into. So we can answer questions about that. But wanted to start off by tip number 1, which is tracking your coursework. We'll talk about your degree audit in a second, but on our website, we have the BA and BS degree checks, where you can go through and basically create a 4-year plan for yourself. It's a fillable PDF, and we emphasize that because things can always change. I would say having a rough idea of, you know, maybe when you want to tackle your lower divisions by, when you want to complete your upper divisions, and keeping them very broad, because especially with the electives, like not every elective is offered every quarter. So that could change based on what quarter you decide to take, you know, a class in. And again, emphasizing the numbers and what they signify as far as upper division, lower division. And I mentioned the degree audit. So the degree audit is going to be your most helpful tool. It is what we use to graduate students. So you always want to be checking it and make sure that it's accurate. I recommend checking it once every week or 2, because if something isn't showing up in the right place, you'll want to let us know and we can update it usually pretty quickly. The first section in your degree audit is all of your department requirements. The next section is your college requirements, and then it's your university requirements, followed by electives. Electives are classes that aren't really being applied towards anything else in terms of your degree audit. So anything in green means it's completed. Anything in red means that something is missing from that requirement. Whole sections can be red, individual sections can be green. Blue means it's work in progress. So that means that you're currently enrolled, but you haven't received a grade yet. And again, check your degree audit regularly, keep a record. You know, this is what we use ultimately to graduate students. So if there's something that's missing, it could be just a quick back message to tell us to manually add it, and we can go in and do that. And then the field experience requirement will not show as complete until you've completed the field experience verification process. So that's, again, on our website, that's how you submit a log or an email on your behalf from your supervisor. And that's how we are able to go in and actually list what you completed. So if you did Health Frontiers in Tijuana, it will say Health Frontiers in Tijuana on your audit in that section. Oops, I did that again. Go back a little bit. So also selecting courses. Our courses page on our website is extremely helpful, and we try to update it at the beginning of every quarter or right before enrollment happens. So the 2023-2024 annual schedule is out now, and it should be on our website. This is basically, we've gone through all of our different departments on campus that we accept classes from, and we see if they plan to tentatively offer it. So you can see what electives are going to be offered in what quarter. We also have fall quarter, summer quarter, which is currently happening now, but we have all the fall quarter classes and what is being offered. So you can see based on which major you are, what is being offered for that particular requirement and who's teaching it. It will say staff if a teacher hasn't been listed yet, or wasn't listed when we compiled it. So this is great, great resource in helping you kind of look through what you need. Now, pre-med and pre-health. I'm going to be talking about pre-med and pre-health a lot during our part 2 of orientation, but I did want to bring it up because I know a lot of you here expressed questions in the RSVP about being pre-med and pre-health. The first thing that I want to tell you to do is to utilize HealthBeat. HealthBeat are the pre-med, pre-health advisors on campus, and you'll want to register as pre-med or pre-health. And if you Google HealthBeat UCSD, click on that. It has a green or a yellow button, register as pre-health and pre-med. And I want you to go and do that after we get off this call, because that will connect you with the resources for pre-med and pre-health. Like I mentioned, as far as advising on campus, there's the college advisor, major advisor, but if this applies to you, there's actually a third advisor, which are the HealthBeat advisors through the Career Center. And they are the one-stop shop for all things pre-med, pre-health. We have a knowledge of it, but they're the actual experts and they know about global health because a lot of our students come in asking questions. So I want to encourage you to visit their website for more info about preparing for your specific pathway, whether it's pharmacy, PA, dental. They have what your prereqs are at UCSD for each course. And the beauty of that is you can overlap a lot of coursework for the global health majors with prereqs. That's basically why we designed the global health BS degree. And the BA too, we've had students graduate with the BA and tackle prereqs as well. So as I mentioned, it's kind of a teaser, but will be covered more in orientation part 2. We'll go through it a lot more and I can actually show you on our website, you know, where things are. And I think Brittany also put in the chat about pre-law advising. We also have a law advisor because some students here are interested in policy and, you know, health policy, getting their law degree. So there is also a similar kind of like HealthBeat advisor in there as well. I really wanted to touch on plans.ucsd.edu. This is a resource that you have access to right now, where you can choose your college, your entering year, your major, and then it will come up with a sample plan for you. Now, it's very general because as you can see here in the example, there's upper division global health elective. Well, that's pretty broad, but you know that, you know, if you're in the BS, you have 8 electives. So you can kind of place them where you see fit. Same thing with the core classes. If you have issues with your transcripts, please contact admissions. They are probably inundated right now because they are trying to upload everybody and finish uploading everybody's transcript by the time they enroll. So they are working on it. I would probably hesitate to contact them right now, but maybe the week of enrollment, if you're not seeing it, it might be worth giving them a call or shooting them an email. But we also, for transfer students, have a lot of resources on our website under our transfer page. There is a transfer, this is the transfer plan for the Global Health BS for Eleanor Roosevelt College. This is just an example. We usually see transfer students not having any issues completing their degree by spring quarter if you're just doing a single major, even minors. We've seen students graduate on time with a minor because you usually come in with a lot of transfer coursework, and that will be notated on your academic history, as I mentioned before, as well as your degree audit. So this is so helpful because this basically is an advisor, an immediate advisor for you in just planning a rough sketch of what you need to do, including your GEs, your university requirements, and anywhere it says elective is just units that you need in order to meet the 180 unit requirement that you need to graduate. So definitely take a look at that, customize it to yourself, and play around with it on the degree check that I mentioned. You can kind of craft your own plan that way. I also wanted to highlight our emails and social media again. I hope everybody after this call takes away to go on and add us on Instagram, on Facebook. There is and I'll find those links in a moment here, but there is a general global health Facebook page. There is a field experience centric Facebook page. We have a general Instagram, and then we also have a global health blog, which actually all of these emails should be in the welcome email, or all of these accounts and links should be in the welcome email that we sent you to notify you about this orientation. So you should have access to it there, but we will also resend this out to all of our new students. And that actually completes part 1. And so wanted to tease part 2, tentatively have it planned for Wednesday, October 4th. This is week 1 of the quarter. We're exploring locations and times to offer it. So more info is going to be announced. It's going to be a great time. I would love to see your faces in person and just, get to know you all. And in this orientation, we're going to be talking about, how to get involved outside of the classroom, things like pre-med, pre-health, law. We'll be going through study abroad. A lot of our students study abroad and want to plan for study abroad. So we definitely are going to be touching on that, and also just ways to get involved with different student organizations. We have Students for Global Health, which I'll tease here. Students for Global Health is our organization that plans events for the global health community on campus. You'll be seeing them early on at week 1. They're going to be at the student organizations and resource support fair that's going to be happening in week 2. And they'll also have some meetings coming up that we're going to share information about. So things like that we're going to be talking about in part 2 of orientation, because we really wanted to allocate enough time to focus right now on enrollment, which I know y'all have a lot of questions on, but definitely focus on the student development and outside the classroom piece after that. So more info will be shared with you via email and on all of our channels. So definitely wanted to open it up. And I know a lot of you have been asking questions in the chat. I think that's great. And thanks to Mira and Sahana and Zoma, if she's still on, and Brittany for answering those questions. I see a question from Kiara J. Will we be able to talk to an advisor? I will love to talk to you all. The one thing that I forgot to mention is just in general peak period advising. We do get an influx of appointments towards the beginning of the year. So you will be able to talk to an advisor, but we ask that in order to request to schedule an appointment, we want you to go through the aspect of enrolling in classes and using the resources that we're providing you on our website and things like this to, try out enrolling, this first time. And if you need help fine tuning it, we will have appointments before summer. So you'll just want to go to our academic advising tab on our website for more information. Before our appointment time, it's going to be very limited because we are still servicing current students on their summer schedules, as well as still graduating students from spring and summer. So you are welcome to ask any questions that you have. Again, I will likely be offering a drop-in session on the day of, on the 2 days of enrollment beginning on First Pass. So it'll just be an open Zoom room for students to come in and ask quick questions. But we really want you to utilize the resources that you have. It looks like there was a question. Let's see. Oh, I think it might have disappeared. Yeah, if y'all have any questions, you're also welcome to unmute yourself. I can try and see.